Hello, and how are you? Welcome to my session on palliative care. And in this class, we're going to focus on the common symptoms in the chronically ill patient. My name is Winnie Barawa. If you're new, this is a lecture or a section that we discuss lectures, lessons, and expert interviews relating to healthcare. If that's your area of interest, kindly remember to subscribe and stay with me all the way to the end. So let's expose on which are those symptoms that encompass a palliative care client or a critically ill patient in our setups. So the first common problem or symptom you may have as pain, nausea, disfigurement, anorexia, breathlessness, loss of social roles, social isolations, dependency, change in faith and beliefs, personality changes, sadness, depression, denial, anger, fatigue, anxiety, neglect, and other challenges could also be financial difficulties. So note, these are so many problems that are spread across the domains that we discussed that could be from physical, mental, social, psychologically, and also spiritual. So these are problems that can be encountered by the patient all through. But now in this class, I'm going to focus more on the physical symptoms that come along with most of the critically ill patients. So the first symptom that I'm going to discuss is pain. Most palliative care patients present with pain, which could be acute, severe, or moderate pain. And because of this, it is important that we put palliative care patients on medication so that it can help them alleviate or reduce the pain to a very bearable level. The purpose of doing pain management is to ensure that the client experiences death that is free from avoidable pain. At the same time, we want to ensure that the pain, the suffering that the patient goes is according to what they're able to handle and is comfortable enough. We have to appreciate that as much as we need to do pain management, the WHO recommends specific approaches on how to handle pain. And the pain management in WHO guideline is due to drugs, or we use drugs, and these drugs are guided by the given criteria. That number one, the drug should be given by mouth or orally. That the mouth or the oral route of drug administration should be the first choice of administration because it is convenient and easy. However, if the oral administration is no longer tolerable, then subcutaneous route should be the next choice. And the second guideline is that the medication should be given by clock. This means that the drug should be given regularly at the same time, more preferably at least 3 or to 4 or more hours of regular giving of the drugs. Third guideline by the WHO on pain management is that the pain management drug should be given by ladder. And by ladder here we mean that you must start with one drug which is the weakest, and then you should increase the dose as necessary. And only should you move to the next stronger drug after exhausting the full potential of the weaker drug. For example, you cannot move straight to opioid drugs such as morphine before you finish exploiting paracetamol. So those are the three levels of exploration: by mouth, by ladder, and by clock. So let's see more on what it means by ladder. So pain management analgesic ladder entails three levels where we have the first level is the non-opioids. So these are weaker drugs that includes paracetamol and other non-steroidal anti-inflammatory drugs. And if the step 1 or level 1 of the medication is not working, is then we're allowed to move to the second step or second level, which includes mild opioids. And this could include drugs such as codeine, which are oftenly combined with paracetamol. But if level 2 is not manageable and the pain is becoming unbearable, then you can move to step 3 and incorporate strong opioids. So in this category, the pain is very severe, and so the patient might need drugs such as morphine and e.g. Oramorph, or if you need more, you can go for subcutaneous diamorphine. So at this step 3, we have more morphine categories of pain management drugs can be incorporated to enable the patient have comfort and to ensure that they have ease in terms of managing the pain levels. Second symptom is anorexia. So anorexia is a state whereby the patient has this uncontrollable sense of feeling nauseated and almost vomiting. So patients here are unable to eat because mostly they feel weak, anxious, and also depressed or nauseated. So now, for us to help a client who has such a symptom, we therefore need to be more emotionally supportive by encouraging our patient to at least feed, even if it is small amount but frequently. We also need to give drugs that can help us reduce nausea. We can also allow the patient the opportunity to choose a diet that they feel favorable enough on their own, ensuring that this choice though should be nutritious and diversified enough to meet the nutritional needs of the client. And mostly prepare meals that are a bit cool and more appealing. However, you can also boost up with drinks or fluids that are well boosted and can meet the needs of the patient. In case patient can't feed orally, then we are allowed to use alternative methods such as parenteral method of feeding the patient. Third symptom we have on the list is nausea and vomiting. And for the best way to handle this is to simply give treatment or drugs that can get rid of the nausea and the vomiting episodes. However, the other option is to ensure that the patient at least is properly positioned to prevent any state of aspirations during the nausea stages or vomiting episodes. The other bit is antiemetic should be administered. This is to help us with the vomiting episodes or to eliminate them. And when you're giving also foods, ensure the foods at least are dry because too much fluids can actually propagate more nauseic episodes and vomiting. Carbonated drinks are known to assist in reducing the nauseative aspect. However, you need to be really careful because some of the carbonated drinks are not healthy enough for patients who are in the critically ill states. And the fourth symptom is depression. So depression means the patient is developing mental breakdown, they are having a mental challenge, and for this case you need to seek the referral of a psychiatry for the purpose of managing this patient. But other options, you can work along with emotional and psychological support, bringing in a counselor, pulling in closely the family members and friends so that they can be close to her, because with this aspect on where they are present, it promotes the aspect of belonging and they will not feel neglected. Thus, it will reduce the severity or the sense of depression that the patient could be going through. The fifth symptom is on diarrhea, and diarrhea mostly it's as a result of side effects of medication, infection, or sometimes a change in the diet. So how should you handle diarrhea? Mostly you're supposed to give the patient low residual diet. Avoid meals that have gas or gas causing foods should be eliminated from the diet. Encourage your patient to take enough fluids other than plain water to replace the lost electrolytes. And be careful when it comes to perineal care. So it's very essential that you maintain hygiene and you promote cleanliness for the purpose of avoiding further infections. If you notice any case of constipation, uh, work around and get high residue diet, or the nurse should also continuously monitor for the loss and also try to replace the lost fluids from the patient. Number 6, we have dehydration. Dehydration comes along due to reduced intake of fluids or excessive loss of fluids. Some dehydration is beneficial though, as it helps in drying secretions and it also helps reduce the risk of fluid accumulation in the cavities. But severe dehydration is not advised or it's not allowed, as this can show that the patient's health status could be deteriorating or it could be becoming worse. So what do you do in this case? Ensure at least you do more of oral fluids should be administered. And if it's really needed, is therefore you can move forward and start administering IV fluids. learn how to monitor input and output accurately, and check on mouth care or oral care, ensuring that the patient oral cavity is clean and neat and well managed. Number 7 is on skin breakdown, where we're being explained that most patients who are bedridden, they are actually at risk of skin breakdown leading to bed sores or skin sores due to lack of movement. And because they're bedridden, they're very weak and mostly present with depression. But now, how do we manage or prevent skin breakdown? The best thing to do is give adequate nutrition with proper hydration so that you can promote skin integrity. Pressure area care or bed sore areas should be taken care well or should ensure hygiene and prevent any form of infection. The best way to prevent breakdown is to also position the patient properly and ensure adequate turning of the client uh, daily or at least 2 hourly to prevent development of the bed sores. And the other symptom is on respiratory problem. So the respiratory symptoms, these are common due to retained secretions, which can result from the patient inability to expirate or immobilities. If a patient stays in one position, it creates that susceptibility to developing retained secretions. Or the other bit, if they're too weak, some of them are not able to cough, and so the secretions in the lungs get retained or in the thoracic cavity get retained. And because of this, they can have other complications in the respiratory system, such as dyspnea or even difficulty in breathing. So for this way, how do you handle such a patient? It's advised that you can monitor respiratory rate in terms of depth and frequency. You can also encourage chest physiotherapy, that is working together with the physiotherapist to encourage the patient either through coughing exercises or general bed constraint exercises. In other cases, give oxygen or administer oxygen where it's necessary. And if you feel that the secretions are so much, then please go ahead and sanction the client. This is to directly remove the secretions and to open the airways. The other bit of respiratory management is to appropriate position the client. Best referred position is the semi-Fowler's position, which is known for increasing the thoracic cavity and allowing enough space for breathing. And the last bit is you can do drugs that are known for helping with reduction of secretions. We can give bronchodilators to open the airways and reduce any form of bronchospasms that seem to bring up the issue of difficulty in breathing. And some of these medications that are helpful includes atropine. So with respiratory problems, you just need to have good assessment skills, see where the problem is, have your monitoring skills on physiotherapy, oxygen, sanction, proper positioning, and drug administration. So those are summarized way of handling the respiratory conditions or symptoms. And this bit here, we're just doing a summary of the medications that you can actually give in case you find any of these symptoms or any of these common symptoms. So there are many, but depending on also the drug indexes that you have in your facilities, then you can work with the given guidelines. But this is just a general view. So for pain, we can have opioids, steroids, and ketamines. For dyspnea, can have opioids and benzodiazepines, and for delirium or mental cases, can have haloperidol. Client who has nausea can also work along with haloperidols, steroids, and also ondansetrons. For anxiety, there are also benzodiazepines. Secretions, you can bring along scopolamines and glycopyrrolates. For cachexia and fatigue, steroids also come handy. And lastly, for depressive cases, you can walk around with methylphenidates, and then you can also use selective serotonin reuptake inhibitors. Ketamine also can be used in one way or the other. So this is a summary of the medications that you can use uh, given maybe you're dealing with any of the given symptoms that are common among the critical ill patients or patients who are under palliative care. So thank you so much for being with us all the way to the end. If you're yet to subscribe, please do so. Drop us a comment if this video was helpful to you, or where do you feel maybe I add more knowledge on, or add more comments on. And don't forget to share. Until we meet again in our next class, bye bye.